We've talked about taking care of our hands and our feet here at Divine Savior Healthcare, but now we're talking about taking care of our eyes. There's a lot of different common problems that we're going to talk about today, and we'll talk a little bit more in depth about some of the solutions to those problems as well. And I'm joined by a great team of panelists, including Dr. Robert Castrovinci, who is ophthalmologist here at Divine Savior Healthcare, and Rebecca Richmond, ophthalmology technician. From Divine Savior Healthcare here in Portage, I'm Justin Riley, and this is Wisconsin Doctors. Welcome back to Wisconsin Doctors. We're here at Divine Savior Healthcare, and I'm really excited about today's show because we've done a series of programs now. 2 months ago, we did taking care of your hands. Then last month, we did taking care of your feet. And now we're taking care of our eyes today. So taking care of things that come in pairs, apparently. So I'm joined by a great panel of folks here today. This is Dr. Robert Castrovinci and Rebecca Richmond. How are you guys?
Doing great today.
Very good, thank you.
First time on the program. I always have to acknowledge that and say thank you for coming on, because it's a big step to come on the program. So I want to just start real quick and have you guys just give a quick introduction of yourselves, born, raised, went to school, thumbnail biography, that sort of thing.
Sure. I'm Robert Castrovinci. I grew up in New York City.
Okay, wow.
And I did my ophthalmology training in the University of Wisconsin here in Madison.
Fantastic.
And spent a year doing a cornea fellowship in Texas.
Okay.
Practiced in Philadelphia for a couple of decades.
But you loved Wisconsin so much, you just had to come back.
Moved back about a dozen years ago.
Okay, excellent.
And practiced here at the hospital.
Yeah. Rebecca, what about you?
Rebecca Richmond. I was actually raised in Wisconsin Dells, so not too far here from Portage, and have lived in the area all my life.
Fantastic, fantastic. So we're talking today obviously about taking care of your eyes, but first let's discuss some basic terms so that we're all kind of speaking the same lingo here. What is the difference between an ophthalmologist, an optometrist, and an optician?
Okay, I think that's a great place to start because so many times patients will show up and say, I've been to the eye doctor.
Right.
And you wonder, is it an ophthalmologist they saw? Did they see an optometrist?
Okay.
Or are they just talking about the optician who made their glasses? So I think that if we look specifically at the different specialties, ophthalmologist is typically an MD type of person who's gone to medical school.
Gotcha.
Has done a training in residency and has really learned the mechanics of the eye, but also the medicine and surgery of the eye.
Okay, so they're an ophthalmologist is an MD, a medical doctor who specializes in knowing, like you said, the mechanics of the eye.
Exactly. So although an ophthalmologist knows about optometry, an optometrist is someone whose training is learning about the mechanics of the eye, and is able to prescribe glasses, contact lenses. Now, about 20 years ago, optometrists did gain the right to utilize eye drops and medications.
Okay.
So most modern day optometrists can actually use drops to dilate the eyes for diagnosis, but also to treat the eyes.
Yeah.
And so in reality right now, optometrists can't do surgery.
Right.
And you know, that's how we sort that part out.
Okay.
Now, opticians, a different branch, and I know Rebecca has been an optician in the past, so she'll let us know about that.
Yeah, an optician and also an ophthalmic technician as well.
Correct. An ophthalmic technician is someone who assists the doctors, whether it's an optometrist or an ophthalmologist. They do the testing and the pre-work that you would need to be done, similar to nursing for a regular MD and your family care providers. An optician is someone who's going to fit and make your glasses for you, make sure that everything is lined up appropriately so that you can see well. They also order and handle contact lenses.
Okay, we have just about a minute left, and I want to make sure we get to that. You guys have a variety of technology available for use in your office. Can you tell us about some of the equipment a patient can expect to see if they pay a visit to your office?
Of course. I mean, ophthalmology is really a high technology field, and it seems like nowadays we use a lot of digital equipment, and fortunately Rebecca knows all about this equipment and she handles every single bit of it.
Yeah, so what are some of the things that somebody could expect to see? What are some of the technology that you have available?
Technology that we have currently is a digital fundus photo, which takes a very specific picture of the back of your eye, so your retina, optic nerve, things like that, so you can get a physical image of what that looks like. It's loaded into your medical record, and we also do something called an OCT, or optical coherence tomography. It gives us a different view of your retina as well.
Okay, excellent, excellent. We have to take a short break actually, but when we come back, we're going to talk about some of the common problems somebody might experience with their eyes. We'll be right back here at Divine Savior Healthcare. Don't go away. Back here at Divine Savior Healthcare in Portage, we've been talking about caring for the eyes. We just went through a bunch of tongue twisters in the first segment, different types of people who are providers for eye care. But now let's talk about some of the common problems that you guys are seeing in your office and when people typically would see an ophthalmologist. So now my understanding is that the problems that people may have with their eyes can usually be categorized into 3 different categories: redness, decreased vision, and pain. So let's talk about redness first. What are some common problems associated with redness of the eyes?
I think that certainly at this time of the year, allergy or environmental issues create most of the irritation that I see that causes redness. So many of those types of problems can be dealt with either by yourself in terms of local treatment with cold compresses and over-the-counter drops. But if that doesn't work, you really need to be seen to make sure that you don't have something that's more serious than that. Things like uveitis or inflammation inside the eye itself.
Okay. So that could be, if it's allergies, obviously this time of year it's likely that it is allergies, but it could be something more if it's kind of an out of the blue, so to speak.
Right, and most lay people will talk about they have pink eye, which is really not a disease entity, but just a lay person's descriptive part of what they are seeing on their eyes.
Right.
And sometimes that could be from a bacterial infection or a viral infection, or it could just be allergy too.
Okay. Rebecca, did you have anything that you wanted to add about that?
No, I think that's pretty good.
Okay, good job then. You did your job. So let's talk a little bit about decreased vision then, because that's the other kind of category.
Right. I think that for most people, and I look at you, your vision could be just decreased because your glasses aren't right. So that's the first thing I'm going to look at somebody. Is it just something simple like that? But in the population of people I see, and I have a tendency to see people who are a bit older, probably the most common decreased vision causes would be cataracts, macular degeneration, things that may require some treatment.
Sure. Now, are these some of the things that these causes that you mentioned, like macular degeneration, would these typically cause a rapid decrease in vision? Or, I think we all kind of assume as we get older, well, I'm probably going to need glasses someday. My vision's probably not going to be what it was when I was 20 years old. Can any of these things that you mentioned ever be mistaken for, well, I'm just getting old?
I think that most of my older patients say that, and both macular degeneration and cataracts really create what I call gradual, painless loss of vision.
Okay.
And so if you have a problem where your vision goes out rapidly, that's really a much more serious issue and probably needs to be seen on a urgent type basis.
Sure. Yeah. What about eye pain? Because you talked about some of these decrease in vision problems being painless, but there's also a category of ailments where people actually feel pain in their eyes. Can you talk to us about some of those?
No doubt. I mean, I think the most common cause of pain in the eye would be some type of trauma.
Okay.
And so corneal abrasion, somebody who wears contact lenses, overwear, that's a fairly common type of thing. But I had mentioned previously on the redness category that sometimes people have inflammation inside their eye, and sometimes that becomes extraordinarily painful.
I would imagine. Wow.
So here's a case where your eyes could be red, your vision could be bad, and now it's painful.
It's all of the above.
A perfect trifecta.
Yeah, perfect trifecta, and a good excuse to come in and see an ophthalmologist for sure.
Absolutely.
So yeah, we're going to take a short break, and we're going to come back. We're going to continue talking about care for your eyes. Rebecca, you're not off the hook just yet. So we'll be right back with more Wisconsin doctors here at Divine Savior Healthcare. Stick around. We've been talking about the eyes here at Divine Savior Healthcare on our Wisconsin Doctors program, and we've talked about some of the problems, and we've kind of clarified a few of the terminology. But now let's talk a little bit about something that's really prevalent, something that's really common that we hear a lot about, probably more so in the elderly than anybody else, which is cataracts. So what exactly, before we get into how to treat them and so forth, what exactly are cataracts?
Right. So many of my older patients think cataracts are some kind of a growth or a film or some kind of tumor or something that's growing over the eye. So it's not anything growing. In our eye, we have a lens that focuses our eyes, and that's crystal clear when we're born. As we get older, it has a tendency to harden, turn colors, develop some opacity. So theoretically, any opacity in our lens is considered a cataract. When that interferes with your vision, that's typically when people will show up, vision not so good.
Right.
And that's really when we're going to discuss cataract surgery with them.
Okay. Interesting. And I kind of had always assumed that it was a film or something that grew over your eye, but it's not. It's literally a hardening of did you say it was the cornea or the retina, or?
It's the lens itself.
The lens itself.
And so that's within the eye, not on the surface. So that's behind
within the eye.
Right, behind our iris, or colored part of the eye.
Okay, very interesting. Yeah. So is surgery then the only option for cataracts? Is there anything that can slow down the progression or prevent it or anything?
The short answer would be not really.
Okay.
There have been a lot of research projects showing whether certain vitamins or supplements would benefit slowing down cataracts.
Just eating lots of carrots.
I think carrots are good for you, but they don't do anything to slow down cataract formation.
Right.
And so theoretically, if people are taking those things or doing whatever or alternative medical treatments, when they fail, then we go to cataract surgery.
Right.
Cataract surgery, the most common operation that's done in the United States.
Really?
Probably 2.5 million cataract operations are done every year. And it's really not because there's an epidemic of cataracts. I mean, it's just an epidemic of people as we get older.
Yeah.
I mean, people are just living longer.
Sure.
And so I've operated on someone as old as 100 years old.
Wow.
Lives alone and drives and lives out here in Wisconsin.
Wow.
So cataract surgery is very, very common. The surgery itself is well worked out.
Yeah.
All cataract surgery is done as an outpatient. Cataract surgery, patients will come in. The actual surgery itself doesn't really take very long.
Okay.
And within a couple of hours, they're back home.
Wow, okay.
I'll see them in the office the following day and often send them back to their activities.
So it's really an outpatient procedure.
Absolutely.
Wow, that's good to know. And in your opinion, is this something that if we all live long enough, we're going to get cataracts, or do some people just not get them?
You know, that's a great question.
Yeah.
Sometimes I'll see cataracts in people in their 40s and 50s.
Sure.
Sometimes I have patients who are in their 90s and have very little cataract to talk about.
Yeah.
So I think that there's an environmental part of it.
Right.
I think that there's a genetic part of that. And one of the things that I always recommend to my patients, no matter how old you are, is wear sunglasses.
Okay.
I think the ultraviolet, reducing ultraviolet exposure probably decreases your chance of developing cataracts.
Absolutely. And hopefully we'll get a chance to kind of show some of the equipment that you guys use during cataract surgery. But Rebecca, I want to make sure I get to this question. Let's talk a little bit about preparing for surgery. How do we prepare patients for cataract surgery?
Sure. When someone is determined that they need cataract surgery, they can't see very well anymore to do the activities that they want to, they come in and we get some specific measurements called an IOL master, which measures the eye and different curves of what they might need, so that when you take the cataract out and we replace it with a intraocular lens, we get the appropriate power in there so they can still see. Give them directions for taking their pre-operative drops, tell them that they need to see their primary medical doctor so that they are healthy enough to have the surgery itself. Cataract surgery. You need to have a physical beforehand, and you know, that's all real important to give them instructions for what they need to do for care beforehand and after as well.
So that 100-year-old must have been really healthy if you passed the physical prior to going in for cataract.
She was great.
I can't wait to be 100 years old myself someday.
Yeah, there you go, 100 and healthy 100 years old.
Exactly.
We're going to take another break here, but when we come back, we're going to talk a little bit about macular degeneration, which is another common eye problem. Don't go away. There's more Wisconsin Doctors coming up after the break. Welcome back to Wisconsin Doctors. We're here at Divine Savior Healthcare in Portage. We've been talking about eye care, and we've talked about a number of different common issues that people might face with their eyes, and we're going to talk about another very common problem, macular degeneration. And as I understand, there are two types of macular degeneration. Rebecca, can you describe for us what those two types are?
Sure. There's dry macular degeneration and wet macular degeneration. And dry macular degeneration is typically a little bit slower progression.
Okay.
And dry macular degeneration, a lot of times patients will notice that something has kind of suddenly gone wrong with their vision, or things don't look quite like they did before, like words are kind of have a bubble to them, or lines have a waver to them, like if they're looking at a door jamb, it might be a little curved.
Interesting.
And things like that. So you kind of get a sense of what someone is experiencing just by the way that they describe it. So those are the two.
And then, which one was the wet macular degeneration?
Wet macular degeneration, a lot of times patients will say that doorways or
That's
windows,
the curved? Okay.
Yep, they don't look straight.
Wow, I never knew that. So is there anything people with dry macular degeneration can do at home to slow the progression of the disease? Is that possible to do?
Yeah. Dry macular degeneration is the word states is that the retina itself, the blood vessels of our retina are sort of drying out. And this unfortunately occurs in a lot of folks. Many years ago they did a study of several thousand people, and they found that a very specific vitamin concoction that includes vitamin A and E and some minerals like zinc and copper are real helpful to slow the progress down. The study is being repeated right now.
Interesting.
Adding lutein and zeaxanthine to the formula. So if my patients have dry macular degeneration, I do encourage them to take this very specific AREDS formula vitamin.
Okay, and this is an oral supplement then?
That is correct.
Okay.
And it's found on the vitamin aisle of the store. So.
Easy enough to find. You can ask the pharmacist if you have any questions. And ARED is AREDS. AREDS.
Exactly.
Okay, good to know. What about wet macular degeneration? Is there anything that people can do to kind of slow the progression of that?
Right. You know, in the quote old days of ophthalmology, when you had wet macular degeneration, that was sort of the end of the line. But many years ago, and I'm going to say 20 years ago, they found that certain anti-cancer medications that constrict blood vessels were actually helpful in closing off or constricting the blood vessels that were leaking and making the retina wet. These have become to be very effective treatments for the wet form of macular degeneration. And often people who have early wet macular degeneration, if they're seen and treated early enough by a retina specialist, some of them actually gain back some of that lost vision. So that's a real technological advance in ophthalmology that has benefited millions of people.
Yeah, I would say so. And if someone suspects that maybe that's them, if somebody's listening, do they start with an ophthalmologist? Do they start with going to their primary care physician? How do they start that process? Because you mentioned retina specialist.
Right.
Do they go directly to the retina specialist, or do they go to you first?
Well, you know, I would say that any of our eye doctor professionals, whether ophthalmologists or optometrists,
Sure.
would be able to determine what part of the problem that you have. You got to make sure it's not just cataracts or something
Right.
simple, but any of our eye care professionals, certainly here in Wisconsin, would be able to determine whether you would benefit from a retina specialist evaluation.
Fantastic. We are about out of time here, but we've talked about a lot of good things today. Where can viewers go if they maybe have questions or want to learn a little bit more about some things we've talked about today?
Well, I think on our hospital website under ophthalmology, both Rebecca and I have written some informational sheets on
Sure.
the site, and
Sure.
we continue to do that. We continue to
You
add
continue to
those.
update and add as things come up. Well, that's awesome. So go to the website if you have questions, or maybe give them a call. Hey guys, thank you so much for being on the program today. We appreciate that.
Justin, thank you.
Rebecca Richmond and Dr. Robert Castrovinci joined us here at Divine Savior Healthcare, and we are Wisconsin doctors. From all of us here, we invite you to live longer, live better. We'll see you next time.